So basically what I plan to present here, then this is an architect view of the experience of developing health information exchange platform in Estonia. And in order to start from this story, I have to give some background information about the Estonian, so to say, electronic society or digital society. And here are some information for you to just have the background. So in Estonia, we have decided already, like many years ago, that the internet is social right. So we have been forced to decide so because more and more services are available online, and you don't want to leave anyone behind. So everyone must have access to the internet, and we have also found that this is the good way of distributing information, providing education, doing business, and also sharing health information. So we have almost all services that you can imagine that the public sector is providing to the society are available online. So there is kind of only restriction that usually we mention is that you can't sell property online. You have to go to the notarius publicus, and also you can't file a divorce online. So this requires really on-site presence. And also Estonians have been trained to trust these solutions. There have been very few or almost none any issues with information being processed online, and so basically people trust it, and people believe that this is the way to conduct how things should be. Estonia is a rather small country, so it's 1.3 million inhabitants. Out of this, like 70-something% is like native Estonians, and then there is Russian minority, like 25%, and then there are other minorities. And the total area is like I calculated, it's almost like 33 times smaller than Mongolia. Okay, so you can see that Mongolia is more sparsely populated than Estonia, but basically the size of population is comparable if you look at like in general, like how the countries are doing. By the way, this photo or picture here is a picture of the Grand Sing Festival. And usually this field of singing field, we have like 10% of population gathering. So you can on the stage you can see there are like 20,000 singers or something. You can see conductor is here, and then the whole field goes up the hill, and then the rest of the crew is there. We have this like once in 5 years. The grand festival, and then maybe once in 5 years also like this youth festival, similar. Estonia has joined the European Union, NATO, World Trade Organization, OECD, and then there is a group of countries who work together on this digitalization of societies. And the ICT sector is growing. There is always constantly shortage of people, but this is everywhere, so this is not unique. But it becomes quite a big part of Estonian economy already, this ICT sector. So if we have all these services online, and the public sector is working online, so Probably you have this question yourself also, that how to control the quality of these services, or who will pay for the services, so that you can constantly develop these systems that you develop for your own people. And so we have tried to find additional stimulation or additional market for these services that are actually uniquely developed for Estonian e-society. So you can imagine that you develop your schooling system in Estonia, and you want to sell it to somebody else, but this is very unique to Estonian school system. And then you have like also this governmental health record systems, for example, that are basically designed for particular legal context and regulations and cultural context, and then how you open the market so that these companies who actually provide these services for the Estonian citizens, they would find also interesting to develop these services further and provide good quality. So it's not only limited for this small number of people. So we have tested our services against different scales. So maybe particularly today is very good to still see this high rank about digital health. So from one data analyst organization, but then there are also like startup friendliness and cyber security, which are very important for the health, digital health, and freedom of internet and this kind of things, which really good signs. But this is not enough just to benchmark. You need to have like really resource to keep these services good quality. So we have come up with this kind of idea, which is called e-residency. And the idea of e-residency is to allow people who are not living in Estonia to use the services. There's the same digital services provided to Estonian companies and to Estonian citizens, also for people who acquire this so to say e-residency. So they are not physically located in Estonia, they are not don't have visa to come to Estonia, but they still have the digital identity, which is basically the same identity that every Estonian citizen has, and they can access the same services that the Estonian government provides. So basically, if Mongolians applying for e-residency can run business in Estonia, like Estonian citizens, using the same services, using all this digital signature stuff and business registries and tax administration services and all this kind of services. So in general, if you also obtain this e-residency, you can basically log into our patient portal, and of course you won't have many data there because you have not been to the doctor in Estonia, but anyway, you have basically the same digital identity that Estonians have. So the basic idea is still to open a market for the services that are developed for Estonians, for other people from other countries, and in this way to increase the stimulus for maintaining the good quality of these public services, and really bring in more business for these services. So we don't want to pay for the public services alone. We want others also to help to pay for the services. And today we have e-residents from more than 160 countries. There are like 63,000 e-residents, and they have established 10,000 companies. Of course, not all of these companies are very active. They are just maybe, because it's really easy to establish a company just for in Estonia it takes usually like, I don't know, they say 20 minutes to establish a company, with e-residency, there are some things like opening a bank account from abroad. It requires some security checks, but basically it's still very easy to open a company. And these companies pay taxes to Estonian government, so we have earned back some of the money at least for developing these services. So now one very important component of this whole technical environment which enables this digital society is what we call X-road or crossroads, you can say. So this is the system that enables to interoperability of all these services already developed by different organizations in Estonia. For example, you can have a tax declaration service in tax board, and then using this X-road technology, you can make this service digitally available in a secure way to any other organizations which want to talk to the tax administration, to send declarations, to see their balance, to file some schedules or something. And this X-road technology enables to publish this service. And it's not only about tax board. It's not only about government registries like population registry. It's also for the private businesses. So this is like the backbone of the digital society, and it creates trust between all these service providers, so that they can easily provide services, and they know who accesses the services. They can give access to the services using this services of X-road, and they also can access other services. So also our digital health is built on this. So let's say this can be a hospital resource management system here, which can access then let's say health insurance services or e-prescription services or electronic health record database. So this network of services is enabling to work easily integrate all these digital services. So we are estimating that we are saving 1.5 years every year, 1,500 years every year, just enabling this digital communication. And this technology is supported by the legal regulations. The regulations, the government has introduced policies which say that you can't collect the same data that some other system is already collecting. So, for example, if you want to collect residents or citizens' addresses where they are officially registered to live, then according to this policy, only one of these systems should do this data collection. And in our case, it's population registry. So the other systems like tax board or some hospital or some telecom company, they don't need and they shouldn't collect this information. They shouldn't get the data, the permit for processing this personal information. However, they may need this information. Maybe tax board for sure needs information about your location of residence, because of they have to allocate the taxes you pay to certain municipalities. So they then use the population registry to find out where you are actually registered as a taxpayer. And regarding this X-road technology, we have tried to, again, kind of bring this message to other countries that you need similar thing. And we have established a special foundation which manages now the standard of X-road, and this is the international foundation, and this foundation has members. I don't think you see it very well on this screen. Let's try to bring this map. So these round symbols here, they are the members of this foundation: Finland, Estonia, Iceland, and there's this Fair Islands here. And then the green ones are those who also have adopted the X-road technology. They already use X-road technology as a backbone of their digital society. And the yellow ones are in the progress. They develop some system that is based on this X-road. So you can see pretty interesting. And all these countries, of course, call their systems differently. They are not called X-roads in all countries. They use other words for calling these systems. But this is constantly growing, this community of X-road users. And last week, as I remember, the head of the e-health department of Ministry of Health also mentioned that the X-road being considered as an alternative for Mongolia as well. So if we look at the dashboard, what is going on, so this January is about to end, so we have exchanged 70 million messages already, and it's growing constantly on the X-road. And if we look at the 5 most popular services, so we can see that these are Estonian services. They can be also some other countries, Finnish, or there is like a naming convention, so they are governmental services. These are the business registry IDs of these organizations that actually provide these services, and these are short names for the services. The first one is e-prescription. So e-prescription is really used all the time over the internet. So every time somebody goes to the pharmacy and to get the prescribed drug from the pharmacy, then already maybe seven or something interactions over the X-road have been taking place, because the physician who issued the prescription, they got the list of drugs from the drug administration over the X-road. Then they got the insurance status of the patient from the insured people registry. Then they got the drug interaction decision support to test if this patient already has some other drug that is interacting with this drug, so we shouldn't really prescribe it, so we should use some alternative. And then they have issued the prescription, which goes to the prescription registry. And then when you go to the pharmacy, then the pharmacy system accesses the prescription system. And then also the pharmacy system may check the system of consents, that maybe I have given consent to somebody else to get my prescription from the prescribed drug from the pharmacy, so that all these systems communicate to get this prescription processed. Then the second one is the registry of employment. And this is the system in Estonia is very actively used because of managing the fraud of taxpayers. So that, for example, in construction or in agriculture, in some places, temporary workforce is used. But now, in order to avoid any disputes, if this person who is working now on your construction site is not legally employed and you don't pay taxes for this work, then you have to register this employment beforehand. So anytime somebody can come and audit your workers and see if they are registered. And this system is managed by the tax administration. Okay, then this is business registry. So everybody can check who are the owners of company or the members of boards of certain legal entities. Then the fourth is the electronic health record. This is a national health record, so this is also very high. Lots of traffic is related to the EHR. And the last one here in this top 5 is the population registry, or in your case, civil registry. So these are like the top 5 services currently actively used. And if you look at the map, this is now all members of X-Road in Estonia, 25 top interactions during this second 10 days of January. And unfortunately, I can't translate the names of the organizations, but basically you can see here that this is the police and border. This is the tax administration. This is the business registry and some other national registries. This is a land office. This is the organization which manages the electronic health records. So these are like top communication now going on. But if we just focus on this organization who manages the national health records and take 25 top interactions between organizations during these 10 days, then we can get an image like this. So we can see that there is heavy communication between this Center of Health and Welfare Informatics and public health insurance. Okay, lots of traffic here because they get the prescription info and also information about your family, assigned family doctor and this kind of information from the insurance. Then there are hospitals like hospital in one city. This is a Southern Regional Hospital, University Clinic. This is another hospital. This is the outpatient care center. This is the North Estonian Regional Hospital. This is another central hospital in Tallinn. This is the central provider of the X-Road registries. This is the rescue service sending us the information about the ambulance calls. Unemployment fund, and then so on. So many different information. So this information is based on the logs of the X-Road. So these organizations just access the EHR and they get this. We can analyze what is going on there. And of course, if we take the maximum, then this is just a big web of communication around this Center of Health and Welfare Informatics. Basically, these are whole healthcare facilities in Estonia. They are sending in some consultation notes or discharge letters or making queries, patients for the patient visits and so on. Like these are just very small healthcare providers. Some This is like a private doctor, Sergei Tiganik named. So he's some private physician with a small practice, and they are doing something with data there. So that's the X-Road, and the beauty of this X-Road technology is that all these communications go directly between these endpoints. So there is no central hub which is like you often like the central point of failure. So there is no central system which you can shut down and then it stops. No, everybody is talking to everybody separately, and this has also benefited. We have benefited from this architecture during this cyber war, which we had heavy attacks to the Estonian IT infrastructure, but these attacks really couldn't harm any of these. They could only harm one by one. So they could take down one bank maybe, or they could take down some specific database, but in general there is no central system here which is needed. Only these endpoints, they send asynchronously the log information to some location, but this can be delayed. It's not time critical. So this works also in this kind of heavy load situations. And if we look at the eHealth, then the eHealth is basically built on the same platform. We already have the backbone, how all organizations can communicate, so we just take the same idea to the health information exchange. And we already saw the visualization of the logs, how different clinics and hospitals and practices and registries communicate with the eHealth. So we have this government-provided X-Road platform. This platform is mostly supported or maintained by the organizations subsidies of Ministry of Economic Affairs, like State Informatics Agency and e-Government Architect Office. So here they discuss about these general policies of Estonian IT, and then this organization manages the central registries of X-Road. But then we have different other ministries who govern parts of the eHealth system. For example, Business Registry is governed by the Ministry of Justice, and there is a court registries agency which manages and then they have their own IT agency these are different IT agencies here under the governance of different ministries. Okay, here we have Ministry of Social Affairs. They have agency like Health Board. They have Agency of Medicinal Products. They have Institute of Health Development. They have other subdivisions, subsidiaries, and then they have their own IT provider, governmental IT provider, and this IT provider maintains the National Health Record System and the Image Archive and License Registry of Healthcare Professionals and this kind of services. Okay. Then there is Ministry of Interior, Police and Border, and they may maintain the Population Registry. When I want to renew my identity, both digital and physical, I have to visit one of the offices of the police and border guard. And then they update my population registry records, my fresh biometrics like fingerprints and image and signature, and also the other registry data. And then there are in Estonia, all healthcare providers operate basically as companies. They are legal entities which operate according to the business law, and we have hospitals, health centers, clinics, general practitioners, laboratories, pharmacies, and so on. So they are some of these have ownership through the municipality or through the government, and then of course they have like a little bit less freedom in the working as a company. They have to do public tenders and these kind of things. But anyway, they are registered as stock companies or foundations. And then they have their own systems that they use for managing their business. They may have electronic medical records or hospital information system or some other type of laboratory information system, their own image registries, their own pharmacy systems. And then these systems are just connected to the X-Road. And then this National Electronic Health Record is gives access right to one of any of these, like one by one. So you can access this, and then this platform enables to maintain the security of all this communication. And the same way we have research organizations like the Genome Center, which has their own systems where they maintain the results of the genetic research. And then there is Health Insurance Fund, which is like independent public entity, and they maintain the prescription registry, and then they also maintain the registry of insured persons and these kind of systems. And then there is a private company which actually maintains the certificates of our digital signatures and ID cards and these kind of things. So this the governance of the e-health in Estonia is quite colorful, let's say. There are many ministries involved with different systems, but everything digital works through this X-Road environment. So if we look at the little bit like the history, because it's very good to look at the timeline, because it shows the learning process. If you look back like 20 years, then you see how you have learned to do things this way that you do them now. So you have acquired the experience through these projects. This timeline starts from 2000, and among one of the first things we see e-cabinet, what it is. This is basically the government decision making and decision management system. When of course in 2000 it started, there were no flat screens, so there were like big monitors, and there are photographs that the government meetings had this big monitors. Everybody had the big monitors. They had special furniture that they could still see each other, and the monitors were hidden into the tables. But anyway, the main point here is that when government started to introduce the paperless society or policies or solutions, then the government was like the first tester that they can work without papers. So the government office was the first office that became paperless. They started to hold the meetings in a digital way. Also, the tax board was one of the first, and some nice things. So the X-Road actually started also a little bit later here. The concept appeared, and then the solution. And I still remember during development of this tax board that we had to integrate the social fund and tax administration, and then we had this discussion whether to introduce it over the X-road or whether to just do it in the old way, like just point-to-point communication. And then after that, like 2002 is here, we introduced ID card. ID card is was already there in some other countries at that time. But what Estonia did differently, we made it mandatory. We made it mandatory to everyone. So you must have ID card, you may have passport. Okay? And what is what is a consequence of this kind of policy? Is that when you have optional or not very well working ID card, then you won't have all these other services, because the services are very expensive to develop, and then if you don't have proper authentication method for everyone, then sometimes it's not economically viable to do this service at all. But if everybody has secure authentication tool, then you can go on and introduce many new services just based on this simple thing. And then also introduced citizen portal. This is the citizen portal. This is estonia.ee, Eesti.ee, and here, because of the X-road, you can actually develop user interface for the services in many systems. And then this citizen portal is just like the hub where you collect the services for the human user, but actually the services are running on these different organizations. So from this central service you can find information that comes from the prescriptions center, you can find information that comes from the population registry, you can find information that comes from the road administration, like information about your car or driver license. So this is like the single entry point for a person. You don't have to like walk around the internet and find all these services. You can just go there. And then in some point of time, you can see also there is iVoting. Estonia is, I don't know any other countries, but basically Estonians can vote on the general elections and on the local elections over the internet. So when I'm here in Mongolia, I can still vote for parliament or something. And the rate of e-votes have been growing. So that currently the last elections we had like 30% of votes over the internet. So people, especially in rural areas, but of course in cities also, you don't just want to spend too much time finding the polling station and go there and do all this procedure. You just log in and do this over the internet. So we have found it secure enough. Then in some point, like here in 2008, we have introduced the national EHR, and shortly after that also e-prescription system. Maybe just a quick comment about this e-police also. That basically, if you in Estonia you get checked because of some misunderstanding, maybe driving not nicely on the street or doing something, then even if you don't have any documents with you, police has on spot access to all this registry, and you can just tell that, okay, my ID is like this or my name is this, and then they can see my biometric from the population registry and also see all this criminal record and all these kind of things. If I have any parking fines not paid or something, then this is all accessible. So basically, it's not mandatory to carry documents with your car in Estonia, because everything is anyway available. And then the development follows e-residency here, 2014. Yeah, and so on. So then, 2018, we started to exchange prescriptions cross-border. So basically, Finnish people can come to Estonian pharmacy, and Estonians can go to the Finnish pharmacy, and the prescription information is available. And we are working with some other European countries also to introduce this kind of interoperability. And we have this vision that even if we have all these digital services, still often a citizen or entrepreneur is someone who manages the process. So you have to be active, go into the system and trigger some process there, and then go to the other page and trigger a process there. So now we are thinking that, okay, if we can, if we already have all this information, the systems can find out that there is some follow-up needed to this previous activity, and just trigger the other activities automatically. So when you have a childbirth, then like 99.99 time you have to go and apply for the social support program, or apply for this. We have this some kind of government present for the new babies, so all this stuff that you get for free. So you have to like go there, get this. But we know this, everybody does it. So why you have to go there? If the childbirth is anyway registered already by the hospital, and the baby has ID number and parents are registered, then this processes can just go automatically. And then there are lots of these new ideas, and this the e-government architect office is cooperating with universities and other organizations and IT companies to hold hackathons and different events to introduce new proactive processes into the society. So you reduce the bureaucracy, because there is no value anymore added by the human pressing some buttons, because all the information is anyway collected in the right time. And just an example of this is the actually working process. I didn't check the audio here, but let's see if we can still hear it.
Meet 3 Estonian e-citizens, Lee, Martin, and their son, Hugo. Lee received an email notification through the state portal that her driver's license is about to expire. To renew her license, Lee needs a medical certificate, which is issued after a medical checkup. Before going to the doctor, Lee first opens the patient portal to fill out a health declaration. After she signs it digitally, the declaration can be accessed by the doctor. It gives her the information about Lee's health in advance. The pre-filled declaration makes the visit quicker. The health certificate is immediately sent to the National Road Administration, and all Lee has to do is apply for license renewal using the information system of the Road Administration. This will only take a few minutes, and in a few days, she will receive her new license by mail.
So this is the working system. I can later show like my self-declaration in the patient portal. And I have also the screenshots of the road demonstration, but it will just spend our time too much to go it through. Maybe just one small note about this driver license, because driver license must have your photograph on it, and when you apply it to the internet, then there must be somewhere the fresh photograph, and it must be not more than 6 months old, and so typically what happens is that you go to some of these government offices, typically police and border department, and there are this automatic photo booth, and you go there, you enter your ID, and then you read the instructions. It takes automatically your photo, signature, and fingerprints, and then you just go away. And this is the new updated image, and then the road administration can just print it on the driver license. So this is automatically. But this is also an example of this interdisciplinary or cross-ministry cooperation, that in order to develop this kind of processes, there must be some organization that really manages this cooperation between different governmental agencies. So that was like a general introduction to this e-society and e-health in this context. So do you have any questions regarding this general